Every amadi shagana mama e mamoha e mama kwaba ba enejume dey so my health my life my pomoding enemy kwa nana Kofi Owusu wa pomoding chiame bakupe dietitian numero 1 Mr. Ubiquitous too many much more your famous favorites wache sampler no maji matarie mashada grossemu grossa ventures papa bi designer come say oh say last week no me the back could be bro and then so me the soron could be bro e dinkra symbols jinya me ne akeka fe gross ansano amansan betwe we ya gross ansano fe Geraldine Crown Palace Hotel ewo dakuma nyamiche kwan no so otrabre anana kakra bia obehu signboard a me bosu goyi na enimado so bosu no UTV fie afo nyina eboso obehu yen ewo so kura ho na kakra ni se on pam digestion one we 3/4 so come up and down papa bi cut to fit bi grossa why ye ni nyina 0244 250-420 Pacho Fapen natural number mami 0244-250-420 order na yempambi unhia material kra star club no abeya ma o wedding outdoor engagement ma onye bi ma na bibia anye kamaka watare e final pese isito so mawa ko grocer obe ni nyina ma e na afa so maboafo de mi kromumu say train endpoint homeopathic clinic endpoint say I'm free bacho o yare bia ye kranko I didi wo mu adu nya chena na unpe anu edro sa nya won fafa endpoint homeopathic clinic homeopathic remedies are papa bi alternative medicine ko try no so na hwe say ebejewa obenya no wo Kowana Soul Hotel Tema Community 22 hotel na cheaper obehu endpoint ewo nkran na afa so okọ Techima na omo henchia Takrade Anaji Estates na Kumase Ahenema Kokoben obehu grocer obehu endpoint homeopathic clinic ewo ho imebe pon amebo Dr. Idubati number no mama me hwehwe kra na me fama na freno ne koji ayarehwe Dr. Idubati ne personal line na me de ebebrel no na kwa no ahwe 0244 867068 867068 Young Vita say a delicious way to grow. Young Vita a brown nutritious cereals Nutri-B ewomu nutritious vitamins and minerals ebema wakwada na ye inulia ebema niyemu aye meremere kama na afi so omowo omega 3 fatty acids ebebie na dream Vegatem tough on malaria pacho malaria mosquitoes isi otuto na mantua wo fie chire hono ya na konko wo na isi atata mu na mosquitoes yin omowewa pacho mensuro Vegatem tough on malaria wo ho kopebi na nom afi so kantanka emulate herbal supplement ebema jina wona so brane ebema wasrafo na wo kuti anyarewa no omo sipi na omo tumi ako ajew mra yarewa eben wo diabetes hypertension any disease ediwunya chronic disease non communicable disease ediwunya raise your immunity raise your body per kantanka emulate herbal supplement be na fa ya boafo no this way there yentumi nkonja Ghana is evergreen cocoa beverage and ohia pe any issue share and specialized mineral water woman on my soya sene na me suma share grocer fe mitimi danda me ho kakra kire ho na won say atare no eye kama ye dan e ho akwa ba ye ba ye be kasa afa PCOS Polycystic Ovarian Syndrome eno ho asem ne be ka no edi manya pa about 12% 12 to 16% of ma omo ebibrim ha no omo was a problem no e ma wo ho ye den enti sometimes nkofo nam a omo nim se sayare no hye ene ye be brobro mu me den panyimfo mienu bi aba ye beka ho asem ye gi aboafo nkra to ba me dan omo adi a kyerɛ na ye den komo na ahyehye so mpajo twen ewe ebusiafo ya dama zema twen ya age aboafo nkrato aba Pcos, Polycystic Ovarian Syndrome. Ene topic da paso a ye be di ho enkomo no. Na asem na asem pa because sometimes we won't say nkofo worry 2 years, 5 years, 10 years na awoma. Na susu se diem pa na this a problem yi be ye fearful and I say a ding. Sometimes there a condition where you become one semi, and no na deba. And tia whom be here say you be hun and tem, you be hun the faribai. A senya adi ni sukra sitie na ya share na yesia no ansana akohaye later. Senya misikai about 16% of ma or more reproductive age or more do or more one fear so no. Dodo na e wo sa yare no kamia eze uyi mai numa ba ko ye nya sa problem enti na kan asem no asem a wo se ka ho asem ansa enti ye nya panyimfo mienu mia me ba e wo ejuma ye mu say a big woman hey registered dietitian your friend the finest dietitian numero 1 the whole Ghana or no the finest dietitian or your CEO of Hale and Hearty Nutrition so Ridge Hospital or your women's health specialist in diet inti ono no mba ho asempa na odumu akotene and now we can say friend Mrs. Frederica Sewa Doku aka finest dietitian Sewa Makwa
ya mini another yeja
welcome Frederica okay ina me wa mi angaza me uncle how to me papa so over 30 years experience as an obstetrician gynecologist or tradian so wa bim papa a stem cell expert or a laser surgery practitioner and now be cancer specialist or Mary Lucy Hospital sir ewo awoshi ene ofanko wa bim papa ewo ma awoni omo asenyarewa ehwe ho ono ne Dr. Davis Adeze debia no tutu kwan okonso ne menko doc agwa
yeah
Mary Lucy for zen
oh we are here
yeah that's pass wa pemre aba doctor wa brepa you said you up to 4 years manopay but wa be di answer doc ye tinsim ye ka se PCOS
right Polycystic Ovarian Syndrome a bit friend Pcos okay now what it means hormonal problems you can say hormones also hormones your chemicals be a mass side no and a control reproductive awon
okay
so na ovary na baby oba etunkusia efa no so sa problem e ko hye ho different polycystic ovaries
okay
na polycystic ovaries it just say emo ahye nsion kitin bi ensese ne dudu sa so e basa na ama hormones no imbalance.
Okay.
Because there's some problems that happen in ovary nankasa emo. Inti amani hormones no imbalance. Afina affecting inclusive periods and other things.
I see.
And they say your cancer ovaries in a polycystic and just say ultra scan and say na ovaries no and a polycystic. Na symptoms in account a bar and it is syndrome no anything.
Anti-syndrome no ɛkyerɛ sɛ nneɛma bi ɛden di a ɛkyerɛ sɛ wowɔ saa problem.
Exactly.
Okay, yɛbɛkɔ saa nneɛma no mu enti nea wopa kyerɛ ne sɛ ovaries no na ahyehyɛ nsuo nketenkete a ɛma na saa deɛ ɛfiri dog.
Well, in principle, you know, genetics.
Okay.
That is a common. So because why I say and on your polycystic ovaries and I say no and you no correct. Name friend environmental factors ebe count one to say be a certain lifestyle habits and other things. It me money a day in term and I say a must a day more because a cost. Into the bottom line is that we still don't actually know the exact cause, but you say genetics play a role. Into so
nana
in fact, sometimes you cry by a sea and mama to say we say well.
Oh, dog, man, man, pesa, dog. I just me know they fine power.
It may be an equivalent of, but I am
my problem. Mama in your Pcos.
Yes.
It's a dog, man, family.
Any borders, that kind of things. Memo is the equivalent, but then of course, a member the emphasis so be a just
the dog. It's here come
me got to work Polycystic ovaries.
I mean, fear do is I started me train you know quite with the infantry. Frederica, I dare common sir.
Nana, common power. Me who be a cry, me shall say, Nama, me who be one, and my children.
I bet me actually nipa no who I say, oh, say a bet to me, Enya.
Yes, nese ewo mu na wode nam. The dog na ho evisa no. Se na dog kan.
Yeah.
Pempini se be man so tumi wo bia, ode awo ne ba.
Okay.
Nti be ne maami ni bi. But wo ye be man nti wo ni ovaries nti en show, e be show wa pempem. Na ode wo ba girl a, na wo ba girl no a start say
no problem. And I say not just a genetic risk no. E wo ho ma Bema no any enano ejani enano betumi di ama. Yes,
then it's so in the Obana be a recessive. We bana wa wono na recessive, but environmental factors na dog kan no etumi mane ba intem.
Ushia ma bebre mo was a problem.
Ushia ma bebre
on a daily basis.
On a daily basis, me share ma bebre na ebi mpo omo nim dan say me call baby. And bad time being in a matre. Na penindia no girl. And Michelle Colano, no sense with this or see with 11. No sense patcho why any menses are now or see why yeah, but a massa, a bar, boy, 2 man and mine. I can't come when you know dark nigricans. I dark ankasa. Let me catch and say on finding call hospital, who gaini, no moon sheno. Na enye normal, we can't sape. A chance to me diagnosis will be a new center or hospital. Now for your child scans. Michelle, money be bring Michelle Mono, a year more cancer, a year much or more SS no, and na a banisa, but not SS no, a year more dead. University when your men say you would dead because they buy uncomfortable. Or more, and yes, see, I know if you much I say, we share a ma 5 be a back, I will be. Inti no idea serious simple no senya obi be ware na ese yen hwe sickling yen hwe we won so be ware ahwe se wo PCOS answer because the facility delays ne ba ne adea na fe ema ebusuafo na eyi nso eye worried but wonnim already then we seek early treatment.
Okay. But it me so ano
doc na wo yetu so ano kwan bebre wo ho a
yo yetumi ye I know dey be ko ho no but person ko fo hu say there is hope say any death sentence say o PCOS and just say unwo
just ba wa ntanya
sa che nyama na eden di wonipa no ho a che no bi
nti no so bi anasa oba e wo PCOS first wo hia na onka bibia nche okwa obehu say ne neck very dark
ni kom
tum sin ni baby
I see
bi wo hormone so obehu say ni kom
na ye fifre
ye beba ho enye fifre wo say wo to me de mo sa fa obi ko ho say still na ye dark no so no enye fe
okay
enye shem de ni bi ase epi bi aha ibo so skin tax kra sisi ho
nyama
bi nketenkete bi tuntum bi ewe wo ho afi so no obi ho say wa abodwese ehwi wa ha ehwi wona no ho nyina ma o bebre na
wo fu abodwese any alas 55 wow
oh wo mu yi da o call waxing eyi ho a omo ko ba na ya wax penimfo no kwala ne de na wonu de blade ko ya de bebere
sa e blade
nti no be hu say facial hairs no door so
okay
afa so weight gain obu ho mu a oye kese oye kese a obe feel say aduane nko a na odi ama na ye kese debi with hormonal imbalance no be da be so hwe ko obe kese aha na afa so no ne period enso ma
okay
nti bu ho mu a oye kese utumi bisanse within 3 months why kese bia kan see kese na me you
okay
nti unexplained weight gain
onto me chase
and na obi ho so we hu akwaya diet ni ade nyina
still weight ni
baby ejina
efi
nti we nya expert obeye say normal weight loss na still na no gain weight afen so no utumi lose wo hair say na dog kan alopecia na say baldness like ufinfi nyina ebi ni ho etumi ko
na wiga no be
ebi ni shada ebi so very rough skin
okay
omo skin no very rough and na omo knuckles ha nyina won say na mema de na ye din no sa na omo so de no na ye dark ano onipa no mpoye but ayesa afen so no ebi muso nya anxiety and depression mood swings
okay
enti no woni ne kasa osre a na wasweshi na ne buefu de den ana say bibi kakra na osu enye ne de bibia enye ne de wo wiase ni mood swings no enko yie ebi mu nso ho so a omuntumi nna bebre na anajo omuntumi nda nti so no ye nocturnal nti no insomnia wo ye den untumi nna and ebi mu nso nya menses but a prolong heavy bleeding until 1 month they be obey the menses. I think say 3 weeks ago Michelle Akola be 12 years onya heavy prolong bleeding ma me dey na hospitals near there almost treating no but the mother was worried say Akola 12 years and should go through that because she has PCOS into omo nya kese omo ya very thin slim ankasa omo so omo dey ho nti no chance den dey bebre
and very well
syndrome no na do
nti na jaza uhu baba na wo hwe se ebia na owosa achansudie bi but I know jaza automatic so wo bia na jaza o PCOS okay doc dear hormones symptoms are what can say be what person the can one but dear hormones pa na imbalance abemu ebi atosini na ebi abro so causes our problem
emma hormones are control nkusiato any mema hormones onse oba bia wo mema hormones kakra e wonu so na mema obema bia so wo
hormones kakra
na say obi wa polycystic ovaries emma hormones no den ekosro na say dose wo sa ba dem nyefre hyperandrogenism na ene na di sa enwia sister Frederica King because was a mema testosterone mema hormone esa the ba so no more polycystic ovaries no enya sa high testosterone level na
testosterone kosro
anti bibia ensese ma normal hu se ba enwi ba se ma body mustache mo fru say nwin free pubic hair na be say mo fru ma and that in the means of chest na in the koko
na hu so
yes mo na ho ne mo nsan ho nyina into hu straight ever hirsutism let's just say a dorsal dodo there one main hormone as our hormone na testosterone no edin so be bre eba e wo ovary hormones no ovary na nkasa emo because it affect nkosia so because say remember hormones e wo ovary no too much ma nkosia no and quality so na BBT is a prolactin hormone ba ko bi so ma no hormones eba and no so na polycystic ovaries for ya na was to be how polycystic ovaries don't say that no formuncio no for
obra on ananwe okay na nufo no puncio
yes yeah eba
wow
and also hormones be so friend luteinizing hormone sa luteinizing hormone is nkosia form oba ni ovary no ma and a man nkosia na matured but there were too much a man nkosia no maturity no by it was or too nkosia but any quality and e binu so ha wo so munya on period pe busumi bia inso na on too nkosia yes anovulation
yes e just nkosia no ba emma but period no ba
yeah
wow
yeah
I no dog I no omo period be 2 days ebetumi akase ebia na sa eno symptom it is Frederica can say ebidum ye prolonged bleeding ebia 7 days and baby but 2 days and 1 day is where
yes polycystic ovaries may affect period in various forms
okay
ebina sister Frederica kai bo wana emutwi prolonged ebi so ho makra and say busumi adudu ahia sana ba ko biaba and almost the ebinum so de na eba kete essence hormones no gain imbalance into because ebi ho no mo friend estrogen hormone no ekosro ebinum so ho mo de ne ewo fam nti obi sa na oboka so me period ba drop polycystic ovaries at me money
wow
yes ebasa na into be also catch us first time period the bar 5 days 6 days I say the bar 2 days then so flu papa into it be affected the period disturbances I will quite so
other na doctors be bring to me diagnosing it easily sir because I dey wonk of I didn't something na go boom any eguso
one over reliance on ultrasound and ultrasound also uko cha na ucha abdominal efa we flu so bebe no
say scan na e twa
do what so we trust scan see be fine is we try vaginal scan na find out and the man who ovaries ni
and there was so cool
yes the point number 1 it is uko try no I say oh fine but we try vaginal be tie home pa we try vaginal scan no say oh polycystic ovaries me try scan I can and train you so that is the thing. Now, if you saw wow, we try scan, no, the scan shows the ovaries don't look all right. And yet all the time now, or ultrasound scan may picky polycystic ovaries. Into the combination of symptoms, signs, what I say, and the test. Into biochemically and test I've been running hormonal test, no, and then who say polycystic ovaries, which is a hormone way, ultra ratio of this hormone to hormone way, not a reverse, and I say, and only to be more an idea of polycystic ovaries.
Hormonal assay, no, just a hormonal test, no, testosterone, and the prolactin, and luteinizing hormone, and now just vagina scan.
Yes.
And no,
crucial.
Vagina scan,
TMB. Friend probe.
Okay.
So yes, sure balance and we will just yes, but don't say no advantage I want to say sure balance in a bang ovaries.
Okay.
It's my own ovaries yeah, and into details because we try for fruits of ovaries but inside because and also no chart scan as certain features ovary must what me can say a polycystic ovary. As how can be an follicle. Yeah, so I should say kitty yeah, and ovarian cyst polycystic. Who was actually kitty as so kind in a certain place. No one has a certain number. Now what should to say ovary no a one casano almost say a money white inside no a chain in chain and no because of testosterone na yeah kano ama friend Pcos is a thickening of the inside of the who said I say because of how follicles na yeah but we say thick and dense what you say polycystic ovaries because of that Pcos.
And just say when you are specialized and
yes, exactly.
Okay, you be call prevention no handsome, but I dey okay ama me suru kakra, especially baby Frederica Oka say nkofo de namo a omu nim ne cause iti man go tie vox pop mbra bisa say nkofo nim za Pcos Pcos ya ye ka ho ansem ya ye mbisa omuso munima na de ni ahyenso de kire se ni pay wo ye ba ye ba be ka se one polycystic ovarian syndrome no asem anka de ni nsunsunso obenya na Frederica sharing the role of diet any lifestyle was hard moment vox pop mbra na obehu se Ghana for mo cancer papa.
Matida, but minim idea edeba, and I a being near me, so that so I don't know anything about it. Matida, being near me that. Now, so Matiti say a Mayari, a chronical, a hormonal affecting women, and I may feel say normally no. Affecting in married reproduction age, be adolescent age, and I'm more over no. Say be or bad adolescent age, ne period, irregular period, and a lack of ovulation, and also so to me ma or babesia, it will find a fun ubre, difficult in pregnancy, onyim that, and I may feel say ne cause no, ye name. Ne course ni de yenim ba de me read about ni say yes erani ewo ebusuemu e na cure no so de a chronic condition me feel say o lifestyle bi monomu eno so betumi abia through medication e be ma withdraw and treatment through fertility treatment so betumi aboa but no interest say ebe ko totally definitely no e be bre anu asekakra ama ene na mini
polycystic ovarian cyst no e meaning say e tai e si wo ma so normally ma yare na hormonal like imbalance wo yemu normally imano say shase wo adolescent stage but yenyi no na sisa wo yemu na minim say eno lead ma cause infertility wo ma so entimi ma wonwo eba wo so ma wontimi enyin ewo because ema o period no etresisi na ovaries ne kwa no ovaries na etoto ohua na ema awo ne ba no ema ne mba nti no ema wontimi nyin na normally meaning say nkofo genetic ebia na wo buhwemu minim ne cause mo but minim say ade a wo buhwemu na ebia like ba koso ana say ebia na wo type 2 diabetes eno na actually minim say e cause sa ade no pa na normally no tai ha emma adwen pa because say ebi wo so unhu just say ebia like when we say unni o period no emba ye like inti just say uko hospital na omo ye lab ni nyama wo no omo hu say wo bia eno etai ha adwen pa nti either medication betimi a correct no ana say ebia na doctors no betimi aye bibi aboa wo in ewo fertility side no eno na betimi aboa wo ama ebia wenyin say but ha adwen pa ya ba me experience ba me nim say yare a ha ema a esi omo awo nkwan se esa na ema nkosua no entumi ntu yi ema otumi enyinsen na me found mentis me hu obi a ye
Polycystic ovarian cyst some small fluid be are mostly yamba no eba wo ye ovaries no on side no ena a friend is saying say eba mostly say etimi ma wo yem ye wo ya enu ebi nso etimi ma infertility who try so person who are like emba ena a friend is saying ema wo yem so etimi ye kese enu na meaning about it and I say adults who are home they need to do a surgery for it because my experience in what down for be or no swanya bia okoye scan no and it shows that she's having some inti oko hospital and almost train like omu twins no after the surgery or the process number ma antibiotics bia obetumi anoma and you heal but mostly it me mascara obetumi anya scar be wo you for inside. That's what I know about it.
Nkofo accommodate very very interesting comments and remarks. Ebinum are very 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 funny, but me just say one so will be can and we didn't experts for how much no some no be or we say yes, but almost accommodate. Found their brain were UTV Ghana, Facebook, Instagram, and so and YouTube. And now be come here my page and I could feel so Facebook, Instagram, your dietitian. One ONE dietitian ONE na fa o questions na bra na yembisa emma doc wa Frederica nso ewo ha Frederica mayenko lifestyle ben na increase risk abrabosu ben na etumema ma etanya sa problem yi
yo na me da se medical ka bia ka na doc kan no so se ebi wo homo a ucha scan no kwa unhu enti no ebi mbebe na so me kucha scan me ho hwe but symptoms na wunya no omo criteria na chere say 2 or 3 of that symptom no e chere say e bia na okoye hormonal test no so obehu e wo so
enti unsheda hia scan no in to do the final diagnosis
so wunya scan no kwa na hu sa symptoms
yeah,
3 or more than that symptom I mean say no be an how unya scan to send ya doc kana specialized one and they bet me who be bia ama why na lifestyle no wasem na ye ka dem send ya doc kind no genetic na nipa be na wo recessive nti environmental factor no na ebema na pie ntem na fe yen hwe sisi ye didie ye didie ultra processed foods yedi ema bibia yes ya digi ho na dia share package mu
ya porporo
ho fiber ennim tete eni aduane ni mu afei esichire adoso ewo aduane ni mu afei nso no anwa fat adoso srade adoso aduane mu
chibom ni chiches
saa nyoma no yedi a ema no emwaye especially where you have a recessive gene for PCOS and now say empono just a normal ukra no udi a no so ebe how in another way afei so alcohol ebi mu nom any smoking
any shisha the shisharization of the women
enya asem ketwa
I'm fees on more life
there be enya life but wo na wo how ho say when nya PCOS krana benya other hormonal imbalance there's dysmenorrhea there's amenorrhea there's other hormonal imbalances wo ho a fibroids ni ade nyina endometriosis wo ho nti no ehwehwe ma kire say hormonal no edien na ema hormones no eyesa ena mo kire say there is a metabolic foundation ebe affect hormone no amana aye disturbed nti wudi enyoma enye exercise so nim the bena no yeti ho yenye exercise most of the time no ye very lazy yekoto ade wa kebe faka ye mamo schools omko omote classrooms PE kra ye mamo nye nti akwa no bedu ni menakia obebu ni nsa ne first nsa obebu no na just Pcos na edidi kom no ti kwa bebe na ya kese because of the food omudi any exercise omonye na edisa ne ma no eba lifestyle issues na kan ebini nti no eduane sem no ye bekom o be sem nka so meka to
ye ba management na ye beko but okay to aso
nti no from nutrition point of view no and as a lifestyle point of view no actually say there's an underlying hormonal metabolic disorder into no nutrition no and ebe addressing hormonal no metabolic no example you say insulin into PCOS for no more insulin problem insulin che say sugar no hormone na ehwe so no ni nyina ye hormonal imbalance na bia ehwe so ye into sugar no there's something we call insulin resistance emma hormones no echo high emma insuo no ehhehye wo ovaries ni mu nti as a dietitian no wo ba me ho a first na say yen say we have to find a way to reduce the insulin resistance and no ye be kire wo say enuane a entete wo ye frɛ wo high fiber foods and I say low glycemic index foods and no wudi a ebe ma insulin resistance no start say eba form e bi ni hende ye mo brown rice local brown rice millet dokuno banku no ye fibrous inuane a fiber woma odi a ebebo ama osuga no nso aba form afei so no vegetables and no vegetables has a lot of you can say folate and as a fiber and so wom green vegetable contomere spinach ye tototro ye obi organ ha bebre ye dua
ayoyo mu nyina kan alefu ni bokoboko ni nyina no wo de kan wadua ne die ho a emma insulin resistance no eba fo na folate enso wom nti eye wo mba yo ho no hormones ni ade nyina e work woso afei so no ya ba wo proteins na wo se wodi nhwe ma chere say so bi wo PCOS na se o ma ni di more plant proteins eboa enti ye beans eni ye nkatie eni ye kan say abofo nkatie ni sa nut ni ade no eboa fish wo ho na akokɔ nam so wo ho na no be di but undi ni bebre nti o say 70% of aduane o say ye haban aduane plant base of aduane a wo bedi afei nso no enyoma ade nutrient ba kwa ha PCOS for vitamin D ye wa Africa enso nkofo bebre na feel say ewie wo ha te ewie hyeme na wo be hyedem anapa wo mpia we pe na abotre ewie na akofo ebi ankan nti most of PCOS for no we on labs now they have vitamin D deficiency very low vitamin D nti also mo di nnuane a rich in vitamin no mo san ko gina ewie mu anopa nti na ebi te say nkosua egg yolk no benya vitamin D wo fatty fish benya vitamin D wo na nuts ne milk ne ade a ya fortify no with vitamin D na afi wasa anopa bia no ko gina ewie mu na wonya vitamin D no se ba se yen supplement mawa enso a no so doctor betro amawo a wo be fifa na eba so kakra na wo de aduane no atoaso and another nutrient a wo hia nutritionally no na ye fundamental ye friend inositol na inositol no e we aduane mu na asan convert to inositol no nti wo bones wo fish bones wo meat bones ni ade ena obenya inositol na efim but eya na dodo na PCOS fo hia no wo de aduane na wonya because afei na ebe dane nutrient bi asa akọ dane another nutrient no
nti na ya na doctors no recommend ma omo koto a supplement na omo afa afa nso so no omo sign wo omega 3 rich foods a ebe boa omo nti nkatie any salmon ni tuna ni ade
mackerel
adwene na e ma ne nka ho cause no aye de din
omega 3 ni
nyina free mu tabasi o
dry fish
dry fish na me
omega 3 no sha
esa
eya na nkofo suro fat na e fish no but enu mum na e papa
enu na ye enu na ye papa eni paya nku wo de kan waduane ho a
enu nkofo baby paya yo
enti no chese na ye chechire ya so wo de ye dusuan de eya na ye duane na akoye me friend black and white food emu stew na okoni baby on fa ho
emwa
was say we your bad dear was say woman we duane nsem ehia okofo because if you make say ye mu na nimpa ebe wiase nti se uni a nyakopon be ma nimpa akola na fa wo de na wo no nti you have to build yourself well wo ba girl or ba was what to na aduane die na ye nja ye si kire nuane no drink na
pastry ba ku bi omo ye na anadui nkwala ni dipa gogomi adie bi sa
ba enni message so aka aya na nkwala no pe sa aduane no China fo aduane ni akofa ba esrem yendi ye krom
ya ye body ne ye bayire ni
surprise you say your natural foods no it has everything that we need ebe masa Pcos ne ada condition kra no emma say ye di ni ya control like this no ewo enwanu draw serious ones prevent
galamsey ntinkofu
so say abeye serious amaye nti ye pamacho monhwe na galamsey ni ntwa
na palari ni dia o ma me bisa final questions na me mbra dog so mpacho what is the role of artificial foods ebia say niama the artificial spices bebre aye na ebia chance munam ene sa niama no eno wo twakan bi eka temo ye therapy na mu yi free mana eno so contributed to risk factors.
Artificial food a lot of contribution to PCOS. It's like say enioma ye beka say ewo mu no enye no na mo de ye that is one. Enti no ema ena no so wudi so a eye de more ena ahodi ndro ni endorse wo.
Okay.
Enti no ena nia be ma na ye den so ye sichire anwa oil ne fat fat ne sugar enti no eno no ma ye sugar na ewe mu na ekoso afeso so enchine ye fa ni sodium no edorso because eno na ye de be preserve na enkosei enti enchine ne dorso wa no so kosese nyoma enchine na meka no enye adango enchine na ewo enye artificial salt
fita bisa
eno no emwa kwa
fried rice for no pay you super
eno so na meduane ne yedo
yes
eno no we tites na obekwa akwasan bu akobiem enti no artificial food no ene no nutrient value na wo mu no ewo fom enti no entumi ma nipaduane nya de wo se nya
okay
enti na konti wo ma ye njai it did as close to natural as possible to say na first no ye ma memo ye ye da so ye na wo kontomre abom na wetri se say ye pe kontomre abom kwa de gu chensi na ya si eno na
dog my enhwe medically treatments no ye kana say breakthrough we bi wo mu a odibeka ho na odi aka
medically no I like to start from the diet exercise weight management how na be the start because to a very large extent eboa eyenti say diet patient on top of the diet na ne obeya ma ne bia no ema then etumi juma it is very crucial.
Okay.
Sorry. Now, Sister Federica, about insulin resistance, in the requirement, we check insulin levels because insulin resistance, and muscles, anything, and me, and now exercise, diet, and all this weight management, and muscle insulin resistance. Then after that, also but you be on the bit me fruits, this into me supplements because account. And supplements near Sister Federica boss vitamin D, Nick, inositol, inositol, the B vitamins, zinc, carnitine. The supplements, they are all formulated into one. Okay. That's what I prefer. Say because inositol now or this, but maybe first a blend of everything. Because folic acid, this. And I told you, so my treatments are not just to take care of insulin resistance. Okay. Maybe it is metformin, diabetes. And just say polycystic ovaries or diabetic, even though it didn't mean diabetes, fine. But essence insulin resistance now you can into. Your mom's metformin, a boama insulin resistance, a cough, that's a cough, a muscles, so you're doing. Now, taking it to the next level, process now our cost ovary numa ama nkusiato and some we're taking care of all these vitamins and things. Now, what are you going to do to the ovary itself to make them work even better apart from so amount of this good vitamin supplement environment? There's be a friend of ovarian drilling. So thickness now we can say what ovary. Ovarian drilling. Drilling.
I then you boom to cry.
Yeah, the electrical at me a drill as a punchy holes. Yes, because I would me a disruptive thickness now what ovary no more reset ovary to.
Reset agenda I will ovary
no. Yeah, the ovaries respond.
Yeah, reset yeah, very reset. Ovary. Yeah. Okay. Now see, mo baby amoya mo boom to kurun kiti.
Yes.
And necessary surgical procedure.
Your friend that me. Electrical. Yes. Okay. But of course, they are very highly skilled. Okay. But by and large, these measures now most cases will make the ovaries. I mean, ovaries now I responding. Okay. But the ovarian drilling. But then currently, there is a stem cell approach, and I mean, me use it these days, and. We inject the stem cells into the ovaries. I know every cells, very much so. Because we share stem cells and a controlling immune system, everything. And I will share ovary so the process be my inflammation. Ovary. Okay. Yes. So you want something to break down the inflammation, the thickness there, woman. Stem cells do that because stem cells are at the center of our immune system. It is our inflammation, which some of it is related to immune-related inflammation that causes our ovary. Stem cells do that a lot. Okay. To be honest, I say, IVF, because of polycystic ovaries, which is real, it happens. But I mean, your stem cells are we always get. We always get.
So the stem cell no to me yes. Ovary now. Problem abound. Yes.
Yes. What reset ovary. Wow. And that's what rejuvenate ovary. So that's a very.
The stem cells no more you want that's stem cells.
Patients now yes. Now before I buy stem cells also. You need to diet regime. Okay. So did you anyway? The cell sister Federica. And stem cells Until you chew moja, it may extract the stem cells. Essence we did you any panting, stem cells also are strong. Okay. So when we inject them into the ovaries, they work better. I see. Yeah. It's
moja muna muyi free.
Yeah, you free moja.
Infambium.
You free bone marrow.
Bone marrow. Don't pay no.
In fact, easy to do it.
And ya bebre.
Oh, Debbie. And in fact, on that table no so. You bet me actually don't pay. Now bone marrow don't pay marrow was rich, very rich in
stem cells.
Stem cells. I see. It me inject it into the ovaries. And I feel fat. So I didn't, away. Yet me process it, extract the stem cells, then we inject it into the ovaries. Wow. And you always get eggs, always. If you be on the 40s, mukra we get.
Sir. Hey, and
polycystic ovaries.
And your problems,
and you want to say
first,
yeah, but it's just doing the right things. But they always insist the diet because my kind patient back could be or buy why IVF, I all sorts of fertility for 11 years. Maybe or buy me home. But to say that kind, all when I mean, this is polycystic ovaries, and pampas you trust kind of and I'm saying, look, before I do anything, diet, exercise, lose weight, 3 months, now brought back. Within that period, I run him spontaneously. Yeah.
So wait, no call for na share any dia ni dia. Ni say no buy.
Yes.
Jenye ni say ni nyina na IVF. But two cigarette actually get.
No.
Because me say be IVF first one ye, second one ye, third one. Now unsolved PCOS. Now we go so IVF. We do cigarette kwa.
We do cigarette kwa. Yeah.
It is diet. Now it's now you test themselves.
I'll just give you an example. Recently, just last week, of Italy buy. I don't know no more young Christian. Okay, stem cell. Then we're able to get the eggs. And embryos 6. Wow. And you're freezing. Let me say, go diet, exercise, get your weight down. Answer the year 2. Yeah,
it's one share no.
One share no. I don't still no.
Baby no must sweat day. I catch you so lose weight. Yeah. Now you trim my menche. Or person did your pet and so results.
Yeah. Because the problem is say, one year embryos they will cry. Polycystic ovaries epithelial implantation and koso.
Yeah.
Because hormones now, hormonal imbalance no, affect I would immuno IFN. Endometrium. Yes.
Wow. Very enlightening. Very, very serious. My anchor complications are so one share and treaty now Janice problem then now over to me. Frederica over to me and Kevin Doctor Kevin.
Okay. Mpesa me de bika.
Okay, new kind.
Any doctor kind. I don't know my diet na bo atumiti so am this one.
Because as I would the PCOS no there baby social media baby
the first line of treatment. Who nye bibi akra na because na doctor kan na through diet no say o kwa doctor na catch you say koye o diet na o exercise. O ba me ho a na mama wa diet. Through that na they get pregnant even before they go into the procedure. And na dia ba ko no so say diet no so to aso akopunta ma obegu. Because throughout the pregnancy, when you would diet now, you can even lose the pregnancy.
Oh, miscarriage, yeah.
Miscarriage, yes. So I mean, a mamu bia, omo before me ban come, miscarriage is bare 5 times. And on best started diet, no man feels one ye, no man saying, and near a year or more. Now, for my baby, 6 months later. One of my friends, Mr. Madena kind, me go swam me you. Because I need to see how they come in more 8 months. And that's how I first my womb said, yes. Into no diet need dear.
Very important.
Very before, during,
and
after. And one of complications on the but we all because so my way, we be our 4 and so PCOS. Into I was something you can't my wound and family. And no. Implications no wo because PCOS no insulin resistance no to me emma wunya diabetes. And if you match say emma omo wo PCOS no it to me diabetes type 2 diabetes by age 40.
Wow.
Okay, and wo ban so a oba no be macrosomic baby omo ko omo nyima omo tan so tanya gestational diabetes e ka ho nti wo oba no na oba no macrosomic chese o ye kese ono so insulin ni bi akoko ni mu afan ono so obenyi na recessive na odi to aso nti na ye crucial say obe share with diet na with lifestyle ye say wo PCOS say wa wumpa o say wo ye cause esa kese ne beba mo na fe nsusu no obi wo hormones so a inflammation diet na enya nti no wonya inflammation bebre na inflammation no ko wo me experience mi share omo a omo wo inflammation type of PCOS na wuntumi na anajo afi so munya gut disturbances nti no uyem we dey bibia na I bloated na wo see me bo hwehwe me from me na che say all the gut issues na say koye endoscopy na won na wo chichi ya na doctor na ka say koye diet ko hu dietitian nti wo ba me ho wo dey yesi menya ulcer doctor yesi menya ulcer
no come say PCOS
na PCOS na ne twa U10 na abekosi we na ma nti diet no
very very important
first line of treatment o ko doctor bia ho with PCOS obeka say koye diet na bra
I see. Okay.
It's the fun is serious. Because complications be bro. What if you be to want to mean by life? O skin is so yes smooth and your skin is smooth.
Hey, when I'm sad, so cool.
Come so to me nice 70 days. And no yeah, prelims no. After it leads you to complications of diabetes, to me cardiovascular, and also there is cancer. There is endometrial cancer, there is even breast cancer and is linked because of the estrogen activity, prolactin activity. And you know, I serious. Send a doctor.
Dog, complications were
yes. You know, I don't know, Sister Frederica Abubosi. Complications, metabolic related complications, heart problems, even hypertension. Because weight issues, hypertension, and diabetes, all kind of type 2 diabetes, lipid problems, you know, lipids, intelligence become boom, heart conditions and issues, okay, endometrial cancer, and I say, I would emu cancer, polycystic ovaries, na so estrogen level, no. So breast can get easily sensitive to estrogen and I would know immune so it may a
problem.
There are long-term complications apart from boss related to our home seminar one crown miscarriages. Obi or member we will check here and say polycystic ovaries na I say Obanyima the first 3 months, Busumi and Sano, and the ovary so Ninsano. Okay, because maybe our band with Tunkus, fire ovary, for most 60 different couples, and as a couples luteum, and I be you know, and then the supporting Ninsen until Sense and Benjamin 3 months, not placenta, and Sana, I take it over. It is a polycystic ovaries, ovary number. And to me, provide our support. Until man is an headache. Until no, obi our polycystic ovaries be and make us when you as over near hormonal support even for for the first 3 months of the pregnancy. Now, so we be our treatment into for insulin resistance. It's a metformin near you boss or metwaso. You don't stop. You carry on through the pregnancy. Because after my name as a treatment reading. You can say diet must continue, weight management must continue. So soon as our treatment
I see
must continue.
Very, very powerful. Yeah. But your polycystic ovarian syndrome and who asem near king ya dosu kopa sem no nisu enyan pa nisu ehye na eyade a eyehia sem ndiema ehia yen se ya batan ne awofo yenhwe ye maba ne yi ebi mema no kra because e won say wan hwe ya obetu so betumi de ama oba eti manyeji aboafo kra to mra ye ba ye demokosa ene anudia nsema atwa to ebeba mre na ye mre pa ye gro no na ade esa mpanyimfo enti ye dan ye ho abasesia ye ba ye democostings ebeto us. Ebusiafo ya dama sisema twen amayaji aboafo nkrato aba my health my life so na we ni gusu a wo United Television is all about you ntina yeah the topic saying here I deal with information we untumi infesikanto information crowding from certified experts experience over 10 15 20 years 30 years experience in managing women health na yedi amount cheap free no ti yeda Dr. Davis Adeze and the finest as I say or mo permanent ebe join here my ng final words na bibi omo ye e dia boa PCOS for no na omonka emaye na sorry because the pam chomo fan cheme mere ne kopa pacho mo mo last words in education kakra be
mega say PCOS no ya dia enenampa to your bar check wo ho ya na mpempini we don't know ourselves ye nim ye ho obi okọ na period ko nim time mod start na time mod baby ni ade nti ye hu afen so no ye didie munu ye hye mukina mayen say eduane bi obenya bia na wodi time bi obenya bia na wodi de bia nya ne sa also hu say eduane no nutrient na ewo mu no e support reproductive system ene wo ma ye ho sensem afen so no nam say PCOS no me pe ho asem kanenti no esi ano ye the foundation abebo ade ye boa emayowa omo obi omo ni bi nsusu ye boa omo identify se me go bia me ko check ene eni omo nyanti ye educate omo ene esan ye be advocacy ama omo ye fe no the PCOS Foundation Ghana inti no sesi ano ye wo Facebook ye wo Instagram esan wo TikTok u follow ya PCOS Foundation Ghana PCOS Foundation Ghana okay e wo Instagram Facebook TikTok nyina ye ho ye the information to ho about PCOS ene ni o me wo se wo ye ene ade a ebe mu ni ade a wo besua ade ena ye san so ye numbers wo ho a wo pese wo se wo bia ana se wo pese ye nchechọ kwan wo befa so a wo behwe wo ho so a wo frɛ ya we will educate you on what to do so we akwala ye no parents be kasa na ya cheche mu ahwe wo parents na o ma support you akọ hospital ye wo doctors wo ho a omo hwe diagnosis no scans a obeye ne ade nyina na ya boa ma we hu se me diagnosis ni de na wo se me ye na wa ye answer edu echi
okay yeah that's a doc
so the PCOS, to be honest with you, are much commoner than we think. So yes, 20%, 1 out of 5, because maybe trust scans all the time. To be about a problem or the buy and your PCOS, something different, but we try to know PCOS. But if you are not at that point or need symptoms, into the incidence and casano is a lot more. Now, we share a subset. A problem now. A lot of them. PCOS. It is a common. It's a big issue. A common.
Patches or more. Share about munya. Do drona.
PCOS. Yeah. Nkusia to 30s. Mona. Nkusia and some PCOS. Diet, exercise, weight management, crucial. We starting tema. But when it gets to the point when you come to us, you bet me as stimulating from ovaries, after quite so you bet me then and young because PCOS, so one managing with all these measures now, you can or may almost oh, mean Kusia does so in supervision do not have quality and your quality. Where not fertilize baby, embryo, and your quality. Obeying will be too obeying. It's very important. But they say the final way they say there is real hope for PCOS patients with stem cell treatment. They say a conditioner. You think I say a cure, a curable condition, but management. But manager depending on patient symptoms or one. Yeah, medically that's what. So they'll be in our doors and our person manager. We have a way of going about it. But say I also we have a way of going about it. But say stem cells has made polycystic ovaries. They say big back no polycystic ovaries or by IVF. I don't have a problem. You will get it for you.
I see. Yeah, I see. Okay. That's a part. Check which I wish you.
Yes, Mary Lucy Hospital.
I wish. Okay. Would the mema would do number not to draw now? So be here. Then number 0243 678 526. Patrol 0243
4 3 6 7 8 5 2 6.
Okay. Yeah, that's Dr.
Okay.
Davis.
No problem.
A dead obstetrician gynecologist.
Yeah.
Bakope. Over 30 years experience. Me no achepa. Person because my first locum. I'm here as a dietitian here at Pape Hospital. Very, very powerful. Some 15 years ago, it's meaning na yejuma ache. It's friend no na o problem bia Uncle Bow 0243678526. And now the finest RD, finest dietitian, Mrs. Frederica Sewa Doku, but oya award winner, Papa. Mami bigging up, me banono, me chair na dear kakra. Pacho Nansia Global Women's Leadership Summit and Awards 2025 we need recognized as part of the Global Women's Leadership Summit and Awards. Award no winning and didn't say me boning ama kofu who say on your big girl or your big girl finest. It will as a ojebre ebe kind sani ebe discuss topic. Aha near the uncommon no ABC me that's pa se wo hwe Mr. Grocer fe Grocer Ventures Ataria edinkra papa bi enya wo fe ana can say ade fe na fake am for make agora na matare fe sister menye jealousy 0244250420 and I face so endpoint homeopathic clinic Dr. Duboating or Koana so hotel community 22 Tema community 22 and now Sanso Anaji estates Takrade Hensia Techima and Kumasi so or Ahinma Kokobing Bacho Shenichia Kwani number near 0244 8670 680 867068 and now Tagatem Vegatem soya sine omo konka malaria one time malaria there baza Vegatem no kopebi na on clear malaria na ma na face emulate kantanka imenya ka spend here yes supplement so kan emulate supplement na ma asrafo no engina brand emma na kofi usu na mde adwumadi ehu chiam ye woda se ne ye de nkomotwetwe de bi ebebre memory free say wa pomoding ene wonkwa Italy makra ni
yeah mene wo doctor fine maba tell a friend to tell a friend. Give me the body and come up and a trapper. My health, all my life, oh. Me quite in my pomade, my health, all my life, oh. My pomade, me quite my health, all my life. Me quite in my pomade, my health, all my life. My pomade, me quite. Me no doctor, feel the mother. Tell a friend to tell a friend. Give me the body and come up and trapper, baby. Rubber me sorry, Tintini won't come. Do you wanna learn more? And I get ready, cause it's all about you. My health, all my life, oh. Me quite in my pomade, my health, all my life, oh. My pomade, me quite my health, all my life.